This year in 2018, I've had 2 surgeries. In February, I had a surgery for my ovarian cyst, and on April 30th, I had a second surgery to take out my appendix. In this video, I'm going to tell you about my appendectomy.
I've been running for so long, I'm clear about the path I was on. I was breathless, my heart restless.
Hi, hello, welcome back to Jackie How, my cuties. How are you? Thank you so much for watching another video of Jackie How. I love you all so much. In this video, I'm going to tell you about my second surgery of this year. 2018 has been a rough year to begin with, but honestly, I'm more than blessed. I really appreciate your support, your patience with me, and my family, my friends. Thank you so much for being there for me. And it's been very rough year, but I'm here. I'm very grateful to be here, very grateful for feeling good, and I want to share my story with you about my appendix. If this is your first time here, hello and welcome to my channel. My name is Jackie, and the name of my YouTube channel is called Jackie How, where I show you how I do different things on my hair related videos, makeup, beauty, fashion, and videos like this on how I went through life experiences, just in case these things happen to you, you know how someone else dealt with it and what they had to go through. If you like these types of videos, please subscribe to my channel. There's a little red button. It looks just like this. Click on it, please. It's down below. And also with subscribing, also hit the little bell. It's the notification bell. This way you'll be notified for whenever I upload a video. Let's begin with my second surgery of this year. Everything started on April 29th. It was a Sunday. Sundays are normally very busy. It's a day where I clean, where I do my hair, my kids' hair, just to get ready for the week. That whole day I was having back pains. It was back pains where I had to stop and just like rub my back and like breathe, like, okay, these back pains are a little weird. But I just thought it was because I went through surgery a few months ago and it's just me still healing. But I went along my day. I still did what I had to do. I cooked dinner at 6 p.m. I made shrimp and Alfredo for my husband and my oldest son, which they love seafood. I don't like seafood, so I make chicken Alfredo for me and my baby son, Kyson. You all know him. We ate dinner at 6 p.m. Everyone's happy. Maybe 10 or 15 minutes after eating dinner, my stomach was acting weird. I threw up. I didn't feel good at all. Mind you, my little baby son wasn't hungry yet because he already was eating snacks. So I was like, fine, you eat later on. So I was the only one who ate the chicken Alfredo. So my husband was like, did you cook the chicken right? You know, maybe it's just food poisoning because I was throwing up. And I was like, maybe, but I'm always careful with that. You know, I'm always so sure that I cook my meat properly. But when these symptoms happen, it's just like, maybe, you know? So I lay down after I threw up and I'm trying to relax and I'm trying to breathe, and nothing was really helping me. And my husband saw me in a lot of pain. He was like, we need to go to the doctor. We need to go to the hospital. I was like, no. If you saw my other video, you know how I am. I'm like, no, I'm fine. So I'm like, I'm okay. I'm just going to take ibuprofen because I had painkillers in my cabinet because I had my previous surgery. It's just a little bit of a pain. I'm fine. I took the pill and it didn't help. And you know when it's bad, when painkillers don't help you, when painkillers are just like doing nothing and the pain is still there. So I'm like pacing and I'm like breathing and I'm like, oh my gosh, this is not going any better. And my husband sees me like this and he's getting upset at me because I don't want to go to the hospital. He's like, we have to go. So I didn't really want to go. I was like so scared. And I FaceTime my mom and my mom sees me and she's like, what's happening? And I'm like, oh, I'm not feeling good, but Kelvin wants me to go to the hospital and I don't really want to go. And my mother's like, go to the hospital. And it's just that thing in you where you know you have to go, but you don't really want to. You want other people to tell you to go, which is so annoying. So, you know, her telling me to go and she's going to watch my son. So that was very reassuring, even though I know she would do that anyway. And my husband ends up getting my mom and we go to the hospital. You walk in and you tell them your name and you speak to the triage nurse, and the triage nurse is asking you all the symptoms. When I had my ovarian cyst, I didn't even know I had an ovarian cyst. It just happened where I had an ovarian cyst and I had to get it out. So Because it was in my stomach area, I thought it had to do with my reproductive system. You know, I was telling the nurse that I think it's my uterus or my ovary, my right ovary, because all day I was feeling pains in my back, and then after I ate, the pains moved to the front, which is very weird. In my previous video where I had my ovarian cyst, I told you that I was on the Depo shot. I had to go on birth control just because my doctor recommended it. I've been on the Depo shot ever since because you have to take it every 3 months. So 3 months haven't passed yet. I was still on the Depo shot just to try to get hormones in me and just to try to prevent ovulation so that way I don't get any more cysts. But the Depo shot actually made my period so long. In April, my period was like more than 20 days. It's crazy. So when I was getting these stomach pains, I thought it was because of my period. They take me to the waiting area. Now the waiting area takes so long. I'm waiting there with my husband, and they finally call me in the room and they check me and they take out blood and they're pressing on my stomach, and they end up telling me that they're not sure if it's my ovary or if it's my uterus or if it's something else, because now the pain is more in my belly button area. You know, it doesn't feel like it's my whole stomach anymore. It feels like my belly button. And for some reason, whenever I breathe in, because it like tightens my stomach a little bit, it feels painful. So I try not to move, and I was like very still just so that I don't cause myself any pain. It's very painful to even lay down or someone pressing your stomach. It felt just very tender. As time went by, the pain started to go to my right side. So I was like, this has to be my right ovary. You know, my left ovary had issues last time. Now it's my right ovary acting up. Or maybe it's just my uterus because I've been bleeding with my period for so long. My period has been like crazy. They didn't even seem like it was a big deal for me to be bleeding that long because I was on the Depo shot, and that's a common side effect on the Depo. But it was just so exhausting. They end up requesting a sonogram just to see, you know, how everything looks inside. And before they take me upstairs to do the sonogram, they do give me painkillers, which is good. But the painkillers don't really kick in until after the sonogram is done. And they don't really take the pain away completely. They just kind of like numb it a little bit where it's not so painful. So the sonogram lady, she's asking me questions. She's looking at my insides, and I'm telling her my history. So I guess they're focusing on my ovaries, but the doctor had also said that they wanted to see if it was my appendix. Another GYN didn't see me until 6 a.m. Monday morning. I had to call out of work. It was actually the first gynecologist that did my previous surgery, so it was nice to see her, but it was also not so nice to see her because she was like, hi, oh my gosh, you're back. And I'm like, yes, unfortunately, I'm back with pain again. And these pains are very sharp. Now, these pains are like stabbing pains. You can't really control this pain, and it's very strong. So they try to check me and press my stomach in at the same time, and I'm putting my stomach really hard, not on purpose, but she says that she can't press my stomach in to feel my organs because my stomach muscles are preventing her. They said the best that they can do to get a better image, because the sonogram didn't really show them much, they said. They actually saw another cyst on my left ovary again, which is the ovary where I had to originally get my other surgery on, which is very scary because, you know, I'm on the Depo shot and I'm on birth control to try to prevent these cysts, and they're still growing. So she wasn't concerned about that cyst because it was a small one. They're more focused on my right side because that's where my pain is coming from. So they ordered me a CAT scan. In order for you to do a CAT scan, you have to drink a solution, which is like this big. I don't even know, I think maybe a liter or something. It's not that bad because I've been pregnant before and they make you drink a drink for diabetes, but it didn't taste too good, especially the fact that my stomach wasn't really acting right, and I already had threw up and I haven't eaten in hours, so it's just like, oh. But I drink it. My mentality is the faster I drink it, the faster I'm over it. The nurse, he gave me ice, so he says, maybe it would water it down a little bit and maybe it tastes a little better if it's cold. It honestly didn't really help with the flavor, but it's not that bad. I just didn't think about it and I was just drinking it super fast. At that point, my husband went to the car to try to sleep a little better because he was sleeping on these chairs, which is so uncomfortable. My poor husband. I told him I'm going to text him as soon as they tell me any updates. The gynecologist was telling me, she says they have to figure out what's the cause of the problem. If not, she can do a very small incision just to take a look, but that also means surgery. So it's just like, oh my gosh, either way I'll probably have surgery. So I drink the solution, and then the nurse comes. They have to give me an IV. My right veins for some reason are not good. My left veins are juicier. The IV that he put on me wasn't good. My IV machine kept on beeping. My husband had to keep on resetting it. I guess it wasn't in the right position. It was important for me to have an IV because when I go in for my CAT scan, they have to put a solution inside of the IV. So it's time for me to get my CAT scan. My husband comes from after his nap. I have to go inside this room by myself. Now it's a really big circular machine. They lay you down. Now laying down is difficult because my stomach muscles are not strong and my stomach is in pain. I'm like, trying to struggle to lay down. He's telling me the solution that he's going to put in my arm. It's going to give me a very warm sensation. I might taste like a metal in my mouth. I might have the feeling where I have to pee. So he's putting it in and all you feel is like a very warm sensation. It doesn't feel like you're peeing. It just feels like warm down there, but it's just like something comes in you. Like it feels such a warm tingly feeling. So he puts that inside, but he's like struggling a little bit. He's telling me to keep my arm up. I think it's because of the way the IV was placed. Once he puts in the solution, he goes to the back and I guess he programs the machine to start doing its thing. So it's like the computer is talking to me. So she's like, stay still, hold breath, and then there's like a countdown and whatever, and you read it, and then they put you into the machine and then they put you out and she's like, breathe or something like that. I don't remember. But she tells me what to do. She tells me how to breathe and relax or whatever. So they did it a few times, I think 3 times, back and forth. I had to keep my arm up and straight the whole time because of the way the IV was positioned in my vein. He wanted it to stay up so the liquid can go inside my blood. The CAT scan was over. It was fairly quick, it wasn't something crazy. It was fairly quick. And I walked back to the ER area very slow, but I did it. I don't like asking for wheelchairs or whatever because anything you ask for extra in the hospital, it takes extra long. So I'm like, listen, I don't want to bother anyone. Take me back to the ER. They'll see me there. They'll work with me faster. But everything's a waiting game. That CAT scan I took at 8 a.m. We're waiting around and they call me back into the room and another GYN is there. He's pressing my belly and he's looking at me and he's asking me my symptoms, and I'm telling him my period has been going on for more than 20 days. I'm always feeling cramps because when you get your period you feel cramps all the time. So he's pressing me and he's like, okay, your uterus does feel a little swollen. I'm like, okay, could it be the fact that I've been bleeding for so long? He's like, maybe, but it could be a uterus infection, but they don't really know for sure yet. So we're waiting and then finally the nurse calls me back in and she's like, okay, the gynecologist is treating you for a uterus infection, pelvic inflammatory disease, which is an infection in your reproductive system. Finally, I'm getting some type of answer. She gave me a drink of powder, which is like an antibiotic powder with water, and it tastes so bad. I had to drink it so fast to try to kill whatever infection I might have had in my uterus. So I drink that, and then she gives me a shot in my butt, an antibiotic shot, which is... oh my gosh, that shot burned so much. Like it stings so bad. We sit down in the waiting room, we're sleeping, we're relaxing. Because the good thing about this pain compared to my previous surgery, like my ovarian cyst pain, my ovarian cyst would not let me relax, would not. That pain was intense. That pain was horrible. That pain was like uncontrollably, like really painful. But this one, it was painful, but it let me, as long as I sat still, as long as I didn't do crazy moves, as long as I didn't like press my stomach, as long as I didn't breathe hard, like I was okay. Like I could relax and I could sleep. So my husband and I were sleeping in the waiting room. The nurse calls me again. The general surgeon sees me and she's like asking me what's happening, my symptoms. So she's trying to ask me questions to figure out if it's my appendix or not. She's asking me if I'm hungry, and I'm like, yes, I'm starving. I haven't eaten since 6 p.m. Sunday. Normally people that have appendicitis, they're not hungry. They just don't feel like hunger. I'm like, okay, I'm starving. And then she tells me to lay down. She sees me, like they don't help you on purpose, I think, because she sees me struggling, trying to lay down. I'm like, oh, my stomach hurts, you know, to lay down. So she presses my right side. When she presses it in and she lifts her hand, and that little jiggling part, like the time when she lifts her hand and the bounce, that hurts a lot. So I'm like, oh my gosh, that's so painful. And she's like, okay, now lift your right leg up high, really high, while keeping your left leg down. So I'm like lifting my right leg, and she's like, okay. Like she sees me struggling a little bit, but I do it. So she's like, at this point, we don't know if it's your appendix. At this point, it might be your appendix. I'm like, oh my gosh, just when I took this antibiotic shot in my butt, just when I drank the antibiotic drink, I'm like, oh, what is it? You know, the doctors don't know what it is. So a nurse comes in and he's like, the doctors need to determine if it is pelvic inflammatory disease, like the gynecologists are treating you for, or if it's your appendix. So I'm like, okay, that's fine. So they sit me back again in the waiting room, and I'm waiting and waiting and waiting. And then finally at like about 5 p.m. they call me and they put me in a bed. And they tell me you're being admitted to the hospital. What does that mean? And they're saying that I'm gonna get my appendix out. So I'm being admitted to the hospital. They put me in a bed and they take me to another area where the ER people go waiting for beds, waiting for surgery. Dinner time comes, everybody's getting their dinner trays. But I can't get my dinner tray because I'm going into surgery. So I'm like, oh my gosh, that food smells so good. I can't even eat it. The surgeon who's going to do my surgery actually comes downstairs to see me, and he's like, it introduces himself, and he says, we think it's your appendix. If your appendix is inflamed, it's coming out. If your appendix is not inflamed, it's coming out. So either way, you're going to get a surgery today. You're going to get your appendix out today. So I'm like, okay. That's fine. Whatever it takes for me to be better, to be healthy. And I'm texting my mom and texting my sister, and I'm telling them everything. And I'm like, I'm really going into surgery. Just when I thought I was going to go home with just like a uterus infection, I was like, no, this is serious. I'm going into surgery. So they get me ready. I have to take off my hair cap because I wore my hair cap to the hospital. I have to take off all of my clothes and give them to my husband. No cell phone, nothing. I just start crying, and I cry because a lot of reasons. You know, first, I'm super scared. I get so scared and nervous going into surgery, and then I'm also upset, you know, that I have to go into another surgery, another recovery. It's scary. It sucks. Surgery sucks. Feeling in pain sucks. You know, it's just like, oh, I don't want to go through it again. But you have no choice. It's finally like 8 or 9 o'clock at night, and the transporter takes me upstairs, and he takes me with my husband. My husband can go to like the pre-op room area. The nurses are talking to me, and my husband is giving him their phone number so they can call him after I'm done. And then my husband leaves, and it's just me waiting for the surgery. I'm like, oh my gosh. It's so scary. So finally I get wheeled into the operating room. The doctor wasn't even there. It was like the nurse, the operating room nurse was there. And they're like, sorry, we're waiting for the anesthesiologist. It was a busy night. My surgery wasn't considered emergency. When there's people that are more hurt than me, more sick than me, they were priority, which is fine. So at that point, I didn't have time to really be nervous. I'm like, oh, we're just waiting for the doctors. The surgeon that saw me downstairs, he comes and he looks around. He's like, what are we waiting for? He was upset. And he's like, what are we waiting for? Why is she not on the operating bed? They're telling him we're waiting for the anesthesiologist. They cannot, I guess, transfer me from the regular bed into the operating bed until the anesthesiologist speaks to me. So finally, the anesthesiologist came. I think I waited like maybe 20 minutes, half an hour. And he talks to me. He's telling me everything. I'm like, yeah, I just recently had surgery, so I know how this goes. This is the most scariest part. I hate this part. I moved from one bed where they transported me to the operating bed. And they have my arm strapped, they're strapping me in, they're putting the warm blanket on me, they're getting me ready, and they have my IV. The anesthesiologist is behind me. He puts a mask on me. He's like, this is oxygen. Honestly, my other two surgeries, once they put the mask on, I immediately, like a few seconds later, I'm sleeping. But this time, that wasn't the case. This time, it was like real oxygen, and I wasn't falling asleep, but inside of me I was like so nervous. I was like, oh my gosh, I'm not sleeping yet. Oh my, like inside my brain I'm like, oh my gosh, I'm not sleeping, like just trying to breathe in hard. I need to breathe in this oxygen or whatever this is so I can just go to sleep. And then I feel them, messing with my IV or whatever, and I'm like kind of panicking but also trying to breathe and relax. And then an older anesthesiologist, like he's an older man, and he comes to me. He's like, are you nervous? I'm like, yes. He comes to me right here and he's like, are you scared? I'm like, yes, I'm very nervous. I'm very scared. And he's like, do you know it's more dangerous to drive a vehicle? Like, he's trying to relax me and he's trying to, but I'm like, really? He's like, do you know it's more dangerous to drive vehicles? Do you drive a car? And I'm like, yes, I drive every day. He's like, that's more dangerous than you coming into surgery. Anesthesia, it's not dangerous. I'm like, I know, but I'm still scared. I'm still nervous. He's like, don't worry, everything's gonna be fine. So they still put the oxygen in me, and they start another IV right here because this one honestly wasn't working. They had liquid going in it and it wasn't working. So once they put this one in, he put the oxygen back on me, and I'm breathing. He's like, look at that, your heart rate is going down, because I was panicking. He's like, your heart rate is going down, but it's okay, it's just a sign of dehydration as well. You're dehydrated. Finally, the surgery is done. Oh my gosh. It's the same room where my husband left me when he was giving the numbers to the nurse or whatever. And I couldn't really speak because, when they put you to sleep, they put the tube down your throat. So my throat was so sore and my mouth was so dry. So I was trying to tell the nurse, like, did you call my husband? And I couldn't really speak because my throat was dry, my mouth was dry, my throat felt scratchy. I was asking her, did you call my husband? Because I wanted him to come, So she's like, yes, we called your husband. She was lying, because after that, my husband said nobody called him. And I was like, why is my throat so dry? Why is my mouth so dry? I can't swallow. They gave me medicine to prevent saliva, so that way during surgery I don't choke on my saliva. They give you this thing so that way you can exercise your lungs, and I was doing it, and honestly I only could do this one. And then the next day I can only do this one, and it took me like about a week or so to get all three of them up. It's just like an exercise to open up your lungs, so I was practicing that. After that, I stood in the recovery room. I was in and out of sleep, and I thought I was gonna go home, but I stood overnight in the hospital. I think it was like maybe 1 a.m. They transported me to a room. I was like, oh my gosh, I really am sleeping over here. I had this really calm nurse. He was amazing, and he was very soft-spoken, and he was very calm, and he was asking me if I'm okay and what do I need or whatever. And he was insisting for me to pee. He's like, you need to use the bathroom. I'm like, okay. later because I really didn't feel right. It didn't feel like getting up. A little while later, he comes. He's like, did you use the bathroom? I'm like, no, not yet. He says, well, you should go. I'm like, okay, are you going to help me? He says, no, you can go by yourself. I'm like, okay. I was so nervous, but I'm holding on to the rails. I'm being very extra slow, and I finally pee. And then I don't even have a pad because remember, I'm still on my period after like 20 something days. I go look for a nurse outside and I'm like, do you have any pads or panties? You know, I have my period, I need some pads. So he comes with pads, but no underwear. So I'm like, where is this pad gonna stick to? So he gives me pants, couldn't wear pants. I was just holding the pad, and then when I lay down, you know, the pad was like on the bed, on me. I was in and out of sleep because in the hospital, they really don't let you sleep. But at the same time, it was good I was in the hospital because if not, I would have been in my house. And those beds are good because they help you sit up so that way you're not laying down flat. A doctor comes in to see me after surgery, and I'm like, can I have water? Because I couldn't even speak. I'm like, can I have water, please? So he goes back and he gets me water and a ginger ale. And I was so happy that he gave me a ginger ale. I was like, oh my gosh, I was drinking it so fast. It was delicious. And a little while later, it was like 3 or 4 in the morning, and I'm like, do you have any food? And he's like, no, you know, breakfast time is at 6 a.m. So I'm like, fine. So I'm like, let me sleep, let me drink my water, I'm gonna be fine. So 6 a.m. comes, and this amazing breakfast. It was delicious. It's like 2 huge pancakes, tasty, warm, buttery. Oh my gosh, it was amazing, with orange juice, apple slices. The coffee wasn't good because they didn't really have like sugar and milk. But it's okay because the orange juice was delicious and the pancakes. I was like, oh my gosh, this food is, oh my gosh, it's just what I needed. So I took a little rest, and then the nurse told me that I should get up so I can brush my teeth and stuff. It's like 8 in the morning. So I'm in the bathroom, and I open the door, coming out of the bathroom, and I see my husband. I'm so happy that my husband is there, and he's happy to see me up, you know, that I'm standing up and I'm walking, and he's like, hi. It was so cute for him to be there and to see me so early in the morning at 8 a.m. Tuesday when we came in the hospital on Sunday. It's crazy. The nurses give me a shot of blood thinners because they want to make sure that I don't get any blood clots. They also encourage me to walk, so I go around walking a little bit, and then finally I got discharged. They told me not to drink my ibuprofen anymore, to drink my stronger medication. So I drank that for a few days until I felt a little better. I actually had 4 incisions. So they opened up my belly button again, and my left incision, the same one that they had last time, they put a camera into your stomach to see what's going on and do the surgery with the cameras. They also made another extra incision up here, and they made one down in the pelvic area, and it had like a glue on it, liquid band-aid I guess. So they tell me that I can't carry anything over 5 pounds for like a few weeks, and be active, walk around, drink a lot of water. When I saw my surgeon after my surgery, he gave me the papers of the procedure and what they did, and they fill up a gas inside of your stomach, so your stomach looks like you're pregnant, so it takes some time to go down. And imagine going through that a second time in this year. He said he made an extra incision on the top because I was complaining about my ovary, and he knew that I already had an ovarian cyst surgery, so he says he wanted to have an overview of my entire stomach. He said if he was to see anything wrong with my ovary that he would have called the GYN team, but he saw everything was good, he said, and he didn't need them. My scars are not bad. Some people might say, oh, it messed up my stomach, but honestly, these are my warrior scars. I'm very proud of myself of what I've gone through. It was tough with the recovery process because although my 4-year-old, he's a big boy, I still love carrying him. I still love him on my lap. That's what recovery is for. Take some time, be patient. I definitely don't really have much patience. That's something I have to work on, but I'm very happy that I'm here today. I'm telling you my story because I want to show you how I dealt with my appendix. Here's to an amazing rest of the year. If you are interested in my videos, please subscribe to my channel. Thanks again for your support and watching this video, and I love you so much. I'll see you soon. Thank you. Bye.